First, live, local. This is Fox 12 Now.
Welcome back to Fox 12 Now. I'm Greg Nibbler, live here in studio in Portland, Oregon. And as we all know, it is a big weekend if you are a fan of Seattle Seahawks, or just, it's Super Bowl Sunday on top of that. So, it's just a big weekend for that. And a lot of people like to have a good time on that day, but we wanted to find out a little bit more about how to make sure everybody's staying safe, including watching out for any medical emergencies that are taking place or could happen during some kind of an event like this, particularly for people who may be a little bit more compromised on their health or well-being. And we had somebody come in to talk to us just about that. And that is Kanessa Thompson, who is a paramedic with AMR Clark County. And just having her walk through some of the common things that could happen, what to do, when do you call 911, when do you try to take care of it yourself, and just giving a good guideline on that to make sure that you're not maybe overloading medical services, but that you're also just not calling when you really need to. So she gave us some advice in studio, and I will say, we talked to Kanessa for the first part of this, but then we also have her special guest who joins us, who just happens to be a therapy dog that she travels with everywhere, Apollo. So you will see a therapy dog in this also. But let's jump right into it here. Thank you for coming in here today. I really appreciate it. So I wanted to, if you don't mind, if we could start off, would you mind letting people know, your name and where it is that you work?
Kanessa Thompson, and I work at American Medical Response in Clark County, Washington.
In Clark County, Washington. Yeah. And how long have you been doing that?
It'll actually be 18 years on February 8th.
Wow.
Yeah.
So you have to love what you're doing if you're doing that for 18 years.
Of course I do.
Yeah. What is it about it that you love?
I think it's just the different day to day, and the cliche helping people in their time of need, but just not knowing what you're going to do day to day, and know that you can make a difference in someone's life. Yeah,
you're going into like super stressful situations for everybody, and you're the calm person that's in there solving those problems.
And I'm also paramedic operations supervisor, and so it's also twofold, right? You can help the patients, and I also can be there for my crews as well.
Wow, so helping on all kinds of different angles.
Yeah.
Well, you're in here today to talk about, there's the big game that's coming up. But this could probably translate to like any kind of situation. But there's some common things or what are the most common things that happen to people, I guess, from a medical standpoint during this?
A lot of the most common things we see on a big day like this is, people are preparing food, so kitchen injuries, cuts, burns, things along that line, and you can do a lot of the treatments at home, or you can put some pressure on to stop bleeding, put some ice. Things you can do at home, but if it gets a little more severe and you can't stop that bleeding, or, it's cut through and through, that's when you want to activate 911.
Okay, so noticing, so you mentioned if you can't stop bleeding, if the cut's like deep. What are some other things to notice that would be like, okay, this is a 911 call versus I'm just going to put another bandage on it?
Like I said, if the bleeding is spurting, that's, you probably hit an artery, so you want to seek medical attention fast. Also, like I say, if you can't control the bleeding, or it looks too deep to where it can be fixed with a Band-Aid, you might want to just go get seen and see if it needs a stitch or two.
Yeah, just to take care of that. What are some other common issues that people encounter?
Other things are, it's a high anxiety type day, and so some people that are watching the game are not always in the best of health, and they're not eating the best of food. So we see a lot of like blood pressure emergencies, diabetic emergencies where their sugar is either too high or too low, kind of altered mental status with that diabetic history. So you want to be aware of those if someone's just not acting right or acting appropriate. If they're a known diabetic, treat as you see fit, or as you've been taught. If it's beyond that where you need more help, go ahead and call 911 and we'll come and take them to the emergency room.
So just kind of noticing how somebody's acting, and granted, there's some alcohol that's generally consumed then too, which I'm sure can blur some of those lines and make that a little bit harder, I would imagine.
Yeah, and that's not for family or friends to diagnose or make that decision. So we're call 911 if there's any question, and we'll come and help make that determination.
Okay, so watching out for those. If your cut is too deep, call 911. If somebody's really having some kind of medical emergency to where they're acting really abnormal, Yeah, and you know that that's something going on, then call. What else should people
Along that line of like high blood pressure, altered mental status, we also get a lot more cardiac emergencies, so heart attacks and even cardiac arrest. With that, and sometimes chokings, and the chokings can lead to cardiac arrest. So if you do encounter somebody that has been eating and they're yelling and then they choke, we always recommend to perform abdominal thrust. So where you just put your hands in the center of their stomach and push hard and up to try to get that food out.
Yeah.
A lot of times people do experience a heart attack, right? Another high anxiety day. You just want to recognize the signs and symptoms of that. So profuse sweating, crushing chest pain. A lot of times with males, it'll be like the left arm pain.
Yeah.
Females and diabetics, they present a little bit differently. So if they're just acting off and complaining of chest pain, always safe to call 911. And sometimes those heart attacks or chokings can lead to cardiac arrest. And we want you to call 911 right away. And you're going to be that first chain of survival. And you want to start hand-only compressions, and that's super easy to do. We teach kids of all ages all the way up to adults, and you just put your hands like this in the center of their chest, and you push hard and push fast while you're on the phone with 911.
This is somebody who has like a full heart attack,
Full heart
is
attack.
like on the
Yeah.
ground, unconscious.
Yep, no signs of life, not breathing. They just don't look alive, right?
Yeah.
So skin is pale, clammy, sweaty, no chest rise and fall, not breathing. You want to tap and say, hey, are you okay? No response, and then you can start compression-only CPR. And
Really? So you don't have to do the breathing side of things?
no, a lot of people kind of steered away from doing compressions or CPR at that point because they're like,
Yeah.
I don't want to put my mouth on them.
Oh, yeah.
So we try to teach the compression only, and the goal with that is you're acting as the heart, right? So you're pumping that blood through the body until we can get there and administer medications and electricity and provide that advanced care.
Wow.
And we've seen an increase in out-of-hospital cardiac arrest with people starting early CPR and early 911 activation.
That's great. So reacting quickly is one of those key things.
Yep.
And how was it you put your hands? Just to
So
show?
one like this and one on top of the other.
So
You
just
can
wrap
keep-
it around.
Yep. And then you're going to use the heel of your hand right in the center of the chest. And you're going to push hard and push fast. And you're going to think about 100 to 120 beats per minute.
Okay.
Yeah.
Okay. And so yeah, that's good to know. Like good. And as you mentioned, acting fast while also calling 911.
And I don't want to say the beauty, but maybe the beauty of that is if you get tired, it's super easy and you can teach someone else in the party to do it.
Yeah. Tag out and keep going.
Keep going.
Okay.
Yeah.
Man, so you're saying this in such a calm manner. But so keeping calm, I would imagine, is
that's
another-
the number one thing across all emergencies.
Yeah,
Stay
staying calm.
Yeah.
I guess, yeah, what else should people think about or know, as far as common things that maybe for you are easy to recognize, but for, somebody who's at a Super Bowl party, I'm eating a bunch of nachos, I'm having a beer, I'm not paying attention correctly, what should I be looking out for?
Those are the biggest ones. I think the only one we didn't touch on is maybe a stroke. So signs and symptoms of a stroke. And really the key to that one is going to be early activation, right? Time is brain, essentially. We want to get the person to an interventionalist as soon as possible. So some signs and symptoms of strokes are like facial droop on one side, paralysis on one side, weakness, confusion. They might be drooling a little bit. And the sooner that you can recognize that and call 911, the better the outcome could be. One of the key things that we like to get out there is we need to know the last time they seemed normal.
Okay.
And so early activation, noting that, and getting us there so we can get them to the hospital is going to be the key thing. So I think, like I said, yes, noticing the signs of the stroke is going to be the most important.
Is this something that's good, to maybe have somebody at the party in charge of, monitoring that or looking for these things?
I mean, if everybody's educated on it, then you're good to go. But for some reason, I'm always a person at that party.
Yeah, exactly.
But I mean, yeah, if anyone's first aid trained, they should know this as well. And if they're not, then I recommend everybody go out there and get first aid trained so that way you can recognize all these things. And early intervention is always going to have the better outcome.
That's going to be the key. So have a good time, but pay attention.
But pay attention, yeah.
Pay attention
Especially if you have family members who aren't in the best of health and have these contributing or pre-existing factors.
Gotcha. Yeah. So make sure that you're aware of those things.
Yeah.
All right. Anything else that people should be thinking about as they get ready for celebrations?
The biggest one that I think everybody out there knows is don't drink and drive, because that's another big one out there, motor vehicle accidents. And the only way to prevent that is just don't drink and drive.
It is not worth it.
No.
Not worth it. And then there's so many different ride options out there too that people can take. And
Exactly.
Yeah, so don't do that. And so I can eat nachos and drink beer, just
don't drive.
Just don't drive.
Yeah.
Okay, there we go.
Yeah.
I can handle that.
But you're the guy in charge now, so.
Oh yeah, shoot, now I'm in charge.
You gotta know all these.
No. All right. I'll be monitoring everybody.
Yes, you will.
Well, thank you, for this. This is good advice for everybody, just to really have a good idea of what to do, and in any situation, whether it's for this particular weekend or not. Also, I would be remiss if I did not call out another guest that is here in the room that's been here the entire time. Right here at your feet. This is your buddy that you brought in here.
It is. This is Apollo. This is the reason I stayed calm. This is Apollo. He's a therapy dog. He's been with us at AMR for 7 years. He's on the GMR therapy dog team, which is our parent company. So we have a total of, I believe, 47 dogs across the United States. And he's just here to keep people calm and help in the time of need if they have those bad or traumatic calls. And his job is to get pets and loves.
I mean, it's a tough gig, and you have to hang out with them all the time?
I have to hang out with him all the time.
Oh, that's rough.
He goes home with me. He goes to work with me.
Oh, man.
Yeah. My best friend.
That is awesome. And hey, Apollo. Hi.
Apollo?
Sorry, you're chilling.
Can you sit up? Oh, there you go.
Hi, buddy. Okay, this is horrible right here, but okay. Well, thank you, Apollo.
He might give you a high five.
Hey, Apollo, can I have a high five? Yeah, bud. Oh, that's awesome. And Apollo goes with you to all kinds of places.
All kinds of places, yeah.
Yeah, to help out.
Yeah.
And you mentioned something about traveling too with.
Yeah, we went to North Carolina last year for the hurricanes and hung out with the crews that were providing medical care to the citizens in North Carolina where we were. We've been to Washington, D.C., Indianapolis, and then we've done a handful of local events for local tragedies, I guess, where the crews just needed some emotional support. And we just bring Apollo, and he goes into a room, and we'll just walk around and find the people. We didn't train him to do it, but he finds the people that need him most. And,
oh, man. It just comes up and does this right now?
Does this, yep. I've had people just lay with him and cry, and then it helps them get out what is bothering them.
Yeah.
Yeah.
Yeah,
so.
Just to have a pal like this around.
Yeah.
Oh, man, buddy. Yeah.
Yep.
Nice. You're pretty good at your job, pal. That's amazing. Well, thank you for coming in here to talk about this, too.
Of course.
I mean, both your work there with your pal, but also just good advice for everybody. Any last thing that you think is important for people to know just about first aid or safety, medical safety?
I think we touched on most of it, just early recognition, 911, and be safe.
Yeah. Be safe. Don't drink and drive.
Don't drink and drive.
All right. Cool. Well, thank you so much.
All right. No problem. Thank you.
All right, pal. Thank you. All right, good advice for any kind of party, but definitely for this weekend to pay attention to that. So huge thank you to Kanessa for joining us and Apollo for being in there. Apollo made a trip around the office after that and said hi to a number of different people. But we appreciate you being here on Fox 12 Now, watching us anyway, watching Fox 12 Now. So whether you're on the website or the apps, I definitely recommend downloading the Fox 12 or in apps. They're great ways to just stay on top of what's happening. If there's big breaking news, we'll send you out a notification on that. Otherwise, you can catch up on things or watch any number of different videos we have on there. We've got apps for, of course, your phones or Roku, Fire TV, Apple TV. They're all on there, so you can download those as well. We've got more here throughout the afternoon, so we're going to be with you until 4 o'clock. And if there's breaking news that does happen between now and 4 o'clock, I will be here with that. We're going to switch gears for just a little bit. You'll see the programming switch if you're watching for about the next 15 minutes, and then we'll be back at 3 o'clock with a Friday Cocktails with Julie segment. So just don't drive. That's the main thing after doing that. But, all right, we'll be talking to you here shortly with more. I'm Greg Nibbler. This is Fox 12 Now.